Welcome to the new PG discussion. Okay, we'll start. The first question says identify the test and its principle. So you have a test. Okay, this is a control test, the sample, and this is a sample of a patient. Okay, this is a test known as Nestrov test. Okay, Nestrov stand for naked eye single tube RBC osmotic fragility test. And this is done for patients with thalassemia. Okay, so you see that the sample does not have an overlapping black line which is there in the background. Okay, which suggests that there is no hemolysis. Okay, so the concept is into the contrary, like in patients with hereditary spherocytosis, even the like in this test we decrease the like make the surrounding hypotonic so that the water is filled into the cells and they rupture. That is the basis of osmotic fragility. So but the patients with thal, the RBCs, they do not rupture even if the concentration is made as 0.3% NaCl. Okay, whereas in 0.6 0.7% NaCl, the RBC of hereditary spherocytosis ruptures due to the mutations, and they can't maintain the membrane integrity. Okay, so this is known as naked eye single tube RBC osmotic fragility test, Nestrov test. Okay, and the other tests which we can see in the other hematological conditions are for hereditary spherocytosis we do an osmotic fragility test and eosine 5 maleimide test. Other tests for PNH we do Ham's test and sucrose lysis test. For autoimmune hemolytic anemia we do Coombs test, direct and indirect. Okay, next. And also for sickle cell anemia we perform screening tests like sodium metabisulfite test. Okay, next question is a spotted radiograph. There is history of head injury. This is the picture of non-contrast CT scan. Okay, what you see is in the first point you see that there are hyperdensities. Okay, hyperdensities here. The first point, this is hemispherical sulcus. Okay, the second one is your central sulcus. Okay, and the third one is cisterns of midbrain. So here all these areas you are seeing bleed. Okay, and this is the characteristic 5-star pointed appearance of subarachnoid hemorrhage. Patient will have thunderclap headache. Okay, other images you should see of NCCT are of EDH, SDH, and MRI of diffuse axonal injury. Okay, next. So these are ABC, which are different eggs of schistosoma, so you have to identify them. So what you see in the first images, you have terminal spine. So the spine is terminal. In the second image what you see is the spine is lateral, and in the third image you see the small spine that is known as rudimentary spine. Okay, so the terminal spine is seen in schistosoma hematobium, lateral spine is seen in schistosoma mansoni, and rudimentary spine is seen in schistosoma japonicum. Okay, come on, next. Name the radiological sign and which is seen in which Parkinson plus syndrome. Okay, so what you see here is that in the MRI you see there is cruciform hyperintensity at pons. Okay, at pons, and this is known as hot cross bun appearance. This is seen in multiple system atrophy type C cerebellar type. Okay, multiple system atrophy type A is also known as Shire-Drager syndrome. Okay, and the other Parkinson plus syndrome is your progressive supranuclear palsy, also known as Steele-Richardson syndrome. Here you see a typical hummingbird appearance on MRI. Okay, this is hot cross bun appearance. Next, identify the bone tumor syndrome. Okay, so bone tumor syndrome, what you see here, you can see there are multiple bone tumors. Okay, especially in the hand, which is enchondromas. Most common bone tumor of hand is enchondroma, so you see multiple enchondromas here, and you also see that the tumor has other tumors which are vascular in origin. Okay, so multiple enchondromas associated with hemangiomas is Maffucci syndrome. Okay, if you do not have hemangioma, then it is Oliver syndrome. Okay, next, identify the manure. Okay, so what you see there, this is known as Röntgen's manure. Okay, so Röntgen's manure is basically seen in second stage of labor. Okay, and what you do here is you take a towel and keep it in the below the chin of the baby, so that there is less chances of perineal injuries. Okay, next, identify the nevus. Okay, so you see the nevus, right? Okay, so the nevus which is there, so the first thing in the nevus is the site and is the special characteristic. Okay, and the nevus, so if the nevus is in the eye region, which is the ophthalmic division of the mandibular ophthalmic division, this is known, and if there is no other special characteristic, this is nevus of Ota, right? If the region at the site is shoulder and back and no special characteristic, it is nevus of Ito. If it is on the shoulder, back and the chest, and there are special characteristic like hypertrichosis, okay, then it is Becker's nevus. Next is the IHC marker of the given condition. Okay, you see an electron microscope image as well. So what you see here is the typical tennis racket shaped granules, okay, which is known as Birbeck granules. Okay, characteristically seen in Langerhans cells. So this condition is Langerhans cell histiocytosis. The IHC markers is CD1A for Langerine. Okay. Next, name the signs in the patient of dermatomyositis. So dermatomyositis is what you see. You have name sign. The images are. So what you see here are these papules are there. Okay. So these papules are there. These are known as Gauthran papules. And these papules, the arrangement is also known as Gauthran sign. This is V neck sign. This is Scholl sign. This is nail bed hemorrhages. And you also see a sign on the thigh, okay, also known as Holster sign. Okay, the last question. This is a 34-year-old male. Have come to the EMS with grade 3-4 dyspnea since 2 hours. There is history of DVT in the left leg since 2 months. Okay, so you do a CTPA. Okay, what you see here is, so this is the aorta. Okay, this is the pulmonary, and you see that there is some amount of the contrast is not enhancing here. So this is a thrombus. Okay, so this is case of pulmonary thromboembolism. The question are, the first thing is, what is the most common ECG finding? And that is sinus tachycardia. Okay, the most characteristic which is there is S1 Q3 T3 pattern, and the other thing is the scoring is well scoring. Thank you.